Today, I would like to provide an update that we are making to our quarantine recommendations. Effective immediately, we are updating our recommendation for quarantine for asymptomatic, unvaccinated household close contacts of confirmed cases to align with other jurisdictions in Canada. Starting today, we recommend that these individuals stay home for 10 days after exposure instead of the current recommendation of 14 days. This applies to all Albertans, including those in continuing care. Reducing the length of time recommended for unvaccinated, asymptomatic household contacts of confirmed cases to 10 days from 14 days aligns with data showing the incubation period for Omicron is shorter than previous variants. As new evidence emerges, we will continue to review the appropriateness of the duration of the recommended quarantine period. Our data is indicating that we are likely beginning to turn a corner with this fifth wave. While this is encouraging news, there are steps we need to continue to take to protect ourselves and each other. In particular, vaccines remain critically important. The booster dose has been shown to strengthen protection against severe outcomes from Omicron, including hospitalization. Getting fully immunized against COVID-19 doesn't just protect an individual, it also helps protect those around them. It helps us all by easing the strain on hospitals and our frontline healthcare workers. Over the last 24 hours, we have identified 2,370 new cases of COVID-19 and completed 7,338 tests. Our positivity rate for lab-confirmed cases is about 34%. With respect to the more than 2,500 schools in the province, Alberta Education has confirmed that as of February 2nd, 19 have shifted to temporary at-home learning to address operational challenges. Of these schools, 4 have fewer than 40 students total. Across the province, less than 1% of schools are currently operating online. Looking to hospitalizations, there are currently 1,584 people total with COVID-19 in hospital, including 112 in the ICU. Sadly, 15 new deaths were reported to Alberta Health over the last 24 hours. Our acute care system is still under strain today. We need to continue to protect it, and by extension, all of us. However, it is also true that in the future we will be able to remove restrictions, and indeed we must continue to balance our response to minimize all harms across all areas. The pandemic has never had one single right way to respond, but what is always true is that the actions that each of us take every day matter to our communities.